Welcome to another edition of Your Health Matters with Dr. Benjamin Bryant, Chief of Staff and General Surgeon with UH County Medical Center. Dr. Bryant, how you doing today?
Oh boy, I can't complain.
Did you have a nice Easter?
Oh, very nice.
Yeah, we did too.
Grandkids came up. And
Yeah, great. That's great.
Yeah,
That's what it's all about.
That's what it is about, absolutely.
I know you, before we introduce our guest today, I know you have some announcements to make.
There's a couple of things going on that we want to make sure everybody knows about. There is a Women's Health Expo that UH is putting on. It's a very big deal. We've done it in the past. People have had really positive comments about it. It's coming up Saturday, May the 7th, from 9 to half past noon at the Andrus Banquet Center in Ashtabula. That's at 2259 West Avenue. 2259 West Avenue in Ashtabula. What happens is that there's free health screenings along a number of different lines. There's a complimentary brunch, and there's physician panels that the people who attend can interact directly with the physicians, covering a number of different health topics: women's health, family medicine, cardiology, internal medicine, orthopedics, even more. Okay, admission is free, but space is limited. They tell me doors open at 8 in the morning. I'm going to give a phone number right now that you can call to register, and that's 440-998-0680, so that you will get a slot to come to that. It should be very, very good.
And I think, Doc, when we announced it last year, husbands, if they want to go, can go with their wives.
Absolutely.
Yeah.
And are encouraged to do so.
Okay.
Yeah, the more everybody understands, the better off everybody is.
Sure.
Absolutely. That's a very good point. Thanks, Pat. That's great. The Women's Health Expo, the other thing I want to make sure that people know about is that UH as a system is putting on an initiative called, interestingly enough, Health Matters. I think they stole that from us, Pat. Okay. But what happens is once a month, a doctor will host an informal meeting on a given topic where the public can come in. It's free. You can come in, and it's not like a lecture or anything. You just all sit down at a table together, and the doctor will talk about a particular topic, and you can ask any questions you want. And it's a really great way to really kind of hone in on a topic and have the chance to meet the doctor and talk to him and get your questions answered yourself directly, face to face. So far, the word I get is that the people who have attended those have found that they have been very, very useful. Okay, and the next one coming up is Wednesday, April the 13th. Okay, the doctor there is our very own guest, Dr. Ajay Kumar, and he's going to be talking about strokes, which he's also going to be talking about on this segment. And that's here at the hospital at 6 p.m. I believe it's in this room. I'm not sure. We'll get that clarified. Okay, and as I say, just mark your calendar if you want to come and sit down and really have a discussion with Dr. Kumar about strokes and stroke prevention and so on. And I will also announce the next one, which is Wednesday, May the 11th, again at 6 p.m. And that topic will be living with diabetes. So diabetes is very prevalent. We've covered it a lot on our segment. And you'll be able to come in and really have a good discussion with the doctor about diabetes. All right. So, with that, obviously we do have our friend and colleague, Dr. Ajay Kumar, with us today. Dr. Kumar practices here in Conneaut exclusively. His office is just across the street from the hospital in the medical complex back there. He's in the same practice with Dr. Abbey, who many people know. And Dr. Kumar is going to talk to us about strokes on this segment. Dr. Kumar's been in Conneaut, gosh, you've been practicing for several months now.
Yeah, it's almost 7 months.
Almost 7 months. And from what I gather from him, he likes our town and he likes to practice here.
Yes, I want to stay here.
You know, actually, we did an interview together
Yeah.
when you first came here,
Mhm.
which was like in July of last year or something.
Yeah, it was somewhere in August or September.
Okay, yeah, okay.
Yeah.
That was one of the last interviews I did at AM Live. It was with Dr. Kumar.
That's right, that's
Yeah,
right.
Yeah, so it was very interesting, got to meet him that day, and have not seen him since, so it's great seeing him today.
Well, he's kind of going to be a regular on the show here.
Good.
We have, actually, there's been such interest, we have so many different people coming in. But Dr. Kumar will definitely be back periodically.
Great.
Okay, so, and I think it probably bears emphasizing, okay? Everybody in our town knows that we have had a problem with, quite frankly, doctors coming and then leaving. We have a long history like that. It's very unsettling. People will come to the doctor, form a relationship. It's a good relationship, and then the doctor leaves, and it's just terrible for patients. Well, Dr. Kumar is breaking that pattern. Okay, I have talked with him at length. I talked with him when he first started coming here. We went out for dinner a couple of times,
Yes.
and he made it very clear to me that this practice setting right here in Conneaut was exactly what he was looking for, and that his intention is to be here long-term. So with that in mind, we're especially pleased to have him on the show today.
Thank you.
So what is it that you're going to talk to us about today?
Today I'm going to talk about stroke. Stroke is a term used by doctors, but for the people, they need to understand what is stroke. When a part of the brain dies, it's called a stroke. So for you, when a part of the brain dies, it's called a stroke. And you know that everything in the body, everything, whatever we do, is controlled by our brain. And brain is a structure, and it depends upon which part of the brain is affected.
So the brain, as he says, does control absolutely everything. And what actually is it that can make a part of the brain die?
Sure. So everything in our body needs glucose, proteins, vitamins, all other nutrients.
And oxygen.
And oxygen, yes. And these things come to the brain from the blood. So blood carry everything, whatever the brain needs, whatever organ needs, blood carry everything to them. So what happens when there is a cutoff or there is a breakage in the blood supply to the brain? It can be a clot in the vessel going to the brain, or it can be a rupture of the vessel. It can be of two types, but most commonly it's blockage in the blood going to the brain.
So we have these big arteries. Everybody knows, the heart pumps, and it goes through tubes that are called arteries. And those arteries go everywhere, and they supply the whole body. And that means they go to the brain too.
Yes.
And so what can happen is you can get a blockage in the artery.
Yes.
Okay, and so that means that the part of the brain that artery goes to isn't getting blood anymore.
Yes. So brain is a structure, and there are two main artery which is going through the neck, and they supply different part. It depends upon where the blockage is. It's here, or inside the brain. And depending upon which part of the vessel affected, the brain have damage to that part. It depends upon where the blockage is.
So people who have strokes, they can look very, very different
Yes.
after the stroke,
Yes.
depending upon what part of the brain is affected.
Yes.
Like, for example, some people, we know this, they can think clearly, but they just can't talk.
Yes.
They just can't, translating the thoughts into words just doesn't happen. Or for other people, maybe they can't move their hand or they can't move their leg. So that all comes from which part of the brain was involved.
Yes. So what Dr. Bryant talks, these are all symptoms, and the right hand controlled by the left part of brain, the left hand controlled by the right part of brain. The eye, whatever we see, is controlled by the back of the brain. Whatever we think, is controlled by the front part of the brain. So, depending upon the symptoms, if it's on the right side, there will be a cutoff in the blood supply to left part of the brain. Whether it's limited to only hand, that means only small part of brain is gone. But if it's complete, then it's a large chunk of the brain is gone.
And people have probably seen or know of people where basically one side of their body doesn't work anymore.
Exactly.
And that's a big stroke. That means it was in a pretty big vessel, and that half of the brain was involved.
Yes.
Can you
Go.
come back with the movement once it's gone or not?
Yeah, actually, what happens, there are two kind of a stroke. Okay, one is called mini stroke. It's also called in doctor language TIA, but for you it's a mini stroke.
Okay, right, I've heard
And
of
one is the major stroke.
Mhm.
It's called a stroke. So for you to understand mini and the major, okay? Mini stroke is the one when the patient has symptoms, like patient is sitting, walking, or suddenly he feels weak, or he is drinking and he drops something, or he is not able to think, or he is not able to talk at all. He's kind of a funny drunk guy or something like that. If these symptoms go away in 24 hours, it's called mini stroke. These symptoms can go away, but if these symptoms persist for more than 24 hours, this is called the major stroke. Regardless whether it's a mini or major, you still have to see the emergency room. You have to call that number. It doesn't matter if your symptoms are there or not there.
Mhm.
You still have to
Get
call
medical attention.
911 and come to.
Okay.
Yeah, we're going to take a step back here so that people understand what doctor just said is very, very significant. Okay, if the stroke has progressed to the point that part of the brain is gone, you don't come back from that. Once it's gone, it's gone. Okay, so the whole idea here is to catch it early enough that part of the brain survives. It's impossible to emphasize how important that is. That is just crucially important. And so what doctor's going to talk about, see, people are just cruising around, leading their lives, and then something can happen that will give them a hint.
Yes.
Sometimes the stroke just happens, boom, and that's it. I mean, you have no symptoms, you're going along, boom, you have a major stroke, and that's it. We're going to talk about that. There's still things that you can do. But we're talking about the mini stroke, the TIA. People may have heard that term, TIA. It just means mini stroke. We're going to talk about the kind of maybe little hints and warning symptoms that people can pick up on. And doctor is going to talk about, if you have any of those, what you should do.
Yeah, sure. So, some of the warning symptoms, let's talk about mini stroke first. Warning symptoms like you are holding something and it's slipping from your hand and you are not able to hold it again. Or you suddenly go blind from one eye or both the eye. Other thing, you thinking in your mind but you are not able to express. Or You don't know what you're thinking, but you are talking, and non-stop. You don't know, but your family member can tell you that you are not making sense.
Can people have strange feelings too?
Yeah. Sometimes they are sitting and they feel like their hand is numb. They cannot feel at all. No pain, nothing. It can be it lasts only for a few seconds or can last for hours. But both are the warning symptoms of having a stroke.
So if you can have fairly subtle symptoms
Yes.
where all of a sudden something slips out of your hand, or you stumble and you can't move your foot the way that you did, or somehow you're just not able to talk. It's really strange. You can think clearly, but you're just not able to form the words. But it doesn't have to be dramatic. It can be subtle. I mean, it's definite. You can definitely tell that there's something different. Okay? And then it might go away after a few seconds.
Yeah.
The real danger is blowing that off. See, you've been given a warning at that
Yeah.
point. You've been given a warning. That is not something that you can safely disregard. And if you don't get anything else out of this segment today except this, we will be happy that you got this, is that you cannot disregard that. If that happens to you, or if that happens to somebody that you know, the message is that you have to be seen. And the people who have that, experience that, what should they do?
Okay. As soon as you have warning symptoms, whether you are better after a few seconds or you are not better, you have to call 911. Please do not drive by yourself to the hospital. I can give you 3 reasons why you should not do that. First thing, you have given a warning sign, and let's say you are driving and you have a stroke on the way, you will meet with the accident. First thing. Second thing, whenever you have symptoms, it depends upon how much earlier you reach the place to get the medical therapy. And when you call 911 and they will going to come and evaluate you, they will going to give you some medication that you will not get until you go to the hospital. So they will come and they will give you some medication. It's simple, but it's preventable to progress the brain damage. Okay.
So if you call the ambulance, you get treated faster than if you just go to the emergency room yourself.
Exactly. And the third reason, you don't know which hospital to go. Let's say you have a symptoms and you go to a wrong hospital and they say, oh, we can't deal with the stroke. Paramedics know where to go and they will take you on the right spot at the right time. The cruciality of the time, if you get there in less than 3 hours, the ER doctor will assess you, and if you qualify the criteria, then he can give you some clot buster, and it can completely dissolve the blockage, whatever inside the brain, and it can improve your chances to reduce the brain damage to less than 1 to 2%.
I remember, Doc, with one of the shows we did, this goes back a long time, where you stressed heavily that the significant factor in recovery or saving yourself after a stroke is the immediate attention you need to get.
Yes.
Immediate.
And I remember you stressing that for a half an hour one day, and you made a good point,
Yeah,
because
sounds
you can help yourself big.
Well, I mean, it's impossible to calculate. I mean, it can be the difference between you being able to use your right hand and not being able to
Sure.
use your right hand. How important is that? Well, it's as important as it can get. So the point, again, the point that Doctor made is it has to be immediate. If you have those warning signs, it's not, oh boy, I better make an appointment with my primary care doctor. No, you get on the horn immediately, you get the ambulance there and get to the hospital. Okay? And, well, maybe I overreacted, maybe I just came in and bothered everybody and I didn't really have anything going on. Absolutely the wrong way to think about it. Everybody here understands this clearly and is going to be very happy to see you, to make sure that you're okay. And that 3-hour window, that can make the difference between complete recovery or almost complete recovery and not recovering very much at all. So the minute that this happens, that's when you call 911. And Doctor, maybe you can kind of help us out with this, but my understanding is that I know at our emergency room, this is system-wide for UH, we have protocols in place so that the right thing is done for people in the shortest possible time. And if it's really an evolving stroke or something like that, you'll get the proper medication immediately, and then you'll be life flighted out to the main campus or at a place where they're really set up to do the intensive intervention necessary to treat this. Is that right? Is that how the ER works?
Yeah, there's a set protocol, there are set medication. Once you entered into the emergency room, they will give you aspirin. It's a name of the medication. They will give you aspirin and statin. It's another medication. The earlier they give these medication, the more the chances of recovery. And as I talked to you about, there is a very important thing. It's a clot buster. It's very important. So you have to get there before 3 hours. It's very important.
The medication that they give has a much better chance of working.
Right.
Once the clot gets older, it's not so easy to break.
Yeah.
But if it's caught within that time period, then the medicine will probably work.
Exactly.
Okay, so again, I'm sure that you all are sort of picking up on the significance that we as doctors attach to this. This is the kind of thing where if you're alert and you do the right thing, it's going to make a huge difference in your life or in the life of your family member or whoever. This is one of those things that really, really is important and really counts.
Yes.
Now, Doctor, some people have more risk to have a stroke than other people. Isn't that true?
Yeah, that's true.
What are some of the risk factors for having a stroke?
Yeah, there are two type of factors. One is modifiable, one is non-modifiable. Means one factor you can control, other factors you cannot control. The other factors you cannot control, I will give you a small hint about that, is when you grow older, you have more chance of stroke. It depends upon the sex of the patient. Males have more chance of getting a stroke compared to women. And some genetic factor which is running in the family, some enzyme deficiency, so we cannot control this thing at this time. But what I'm going to talk about are those factors which we can control. I will name some of these factors. One is high blood pressure. Second is if you have high blood sugar. Third is your cholesterol problem. Fourth, very important, is smoking. And if you are gaining weight, you are obese, that's other risk factor. But the four main factors which I am going to talk about, and they contribute majority in your stroke prevention plan. And the first thing is the high blood pressure. It's the single most important factor in prevention of the stroke.
See, people, blood pressure.
Yeah.
Well, if your blood pressure's high, you can't feel it. You don't even, hey, it doesn't bother me.
I have many patients who come to my clinic and I told them that you have high blood pressure. Oh, I'm feeling fine, no problem. Yes, you are feeling fine till you get the stroke, or you get the heart problem, or you get the kidney problem. You are fine. But think about when you are not able to use your hand, your legs, you are bedbound, you are on wheelchair. Think about that.
Exactly. See, the thing of it is, usually, I mean, if you put your hand too close to the fire, it burns and you feel it and you protect yourself. Blood pressure doesn't give you anything like that, but it's still dangerous. And that's the concept to get, that even though you're feeling fine, it's still dangerous. It's in there doing its bad work and not giving you a chance to react to it.
Mm-hmm.
So if you go to the doctor and he checks your blood pressure and your blood pressure is high, you have to understand this well enough to say, okay, I get it. I have to take that seriously. Because, as he pointed out, the most important modifiable factor in preventing stroke, but it also does a lot of other damage. You can protect your heart, your kidneys, your eyes. So, blood pressure.
Yes.
And I assume that you're constantly seeing patients where you're helping them with their blood pressure.
Yes. Most of the time when the patient come to me for the first time, majority of the patient have high blood pressure. It's more because more population is on the higher side, or elderly population. Second thing, they never saw any doctor before. They said, oh, we don't have any disease. It's because you never saw a doctor before. So only a doctor or some test can tell you have this thing. If you never saw, you will think that I don't have anything, I'm perfectly fine. But unfortunately, some of the patients who come with the high blood pressure, they already have kidney damage, they already have heart problem. It's unfortunate, but it's true, okay? So that's why we doctor always recommend to have a primary care set up with some doctor to get periodic assessment of your blood pressure, your cholesterol, your blood sugar, and all this.
Primary care doctors will know you. They'll know your history, your family. They'll know what's going on with you, and they will orchestrate a plan that will keep you out of trouble.
Yes.
And I can tell you, like so many other things in life, keeping out of trouble is a lot easier than getting out of trouble.
Exactly. That's true.
Well put.
So we want to keep out of trouble.
Let me ask you this, Doc.
Yeah.
Are you, of course, you've only been here 7 or 8 months. Are you still taking patients?
Yeah, I'm taking patient.
Okay.
I'm taking new patient. I see patient in the ICU on the medicine floor.
And you can admit, right?
I can admit.
Oh, yes.
Yeah.
Okay, great.
Yeah.
That's a good thing.
I take care of Dr. Every patient. If they come to a hospital, they have more trust in me, so I take care
Okay.
from that for that
Yeah,
patient.
and I'm glad, Pat, thank you very much for bringing that up. Some of the doctors don't admit, that is, they see patients as outpatient, but if the patient has to be in the hospital, then a different doctor is going to take care of them, which is okay. But if it's the same doctor who sees them as an outpatient, and then if they have to go to the hospital, admits them, there's a continuity there.
Yes.
You have the same doctor who knows you.
Exactly.
And this is very important about Dr. Kumar, is that he sees patients in his office, but if that patient needs to go to the hospital, he will admit that patient and he will oversee the care in the hospital. And then when the patient gets out of the hospital and needs follow-up, he will see them in his office. He'll know exactly what happened in the hospital because he will have managed it, and then he can do the follow-up care.
That's
as
so
well.
important. It really is.
It is.
It's important. I'm glad you bring it up. So what I have seen, some of the patients who coming from some other physician or something, they come to the hospital and they get admitted to some other hospital, someone. What happens in the hospital, we review all the medication, whatever the patient is taking. Every time we assess the medication and we make some changes in the medication to go out. When the patient will go out, they have to change this medication. But if there is a glitch in the physician, in the continuity of the care, then these medication skip out of the plan and they go back on the same medication. Somehow something is missed or something, there was no continuity of the care, and that's how the patient land up in trouble again. That's a big problem.
This is a big, big deal. See, this continuity. And, yeah, because obviously life is dynamic. Things change.
Yeah.
Your needs change and so on, and you may be on a medical regimen, and now it needs to be changed because you've changed.
Exactly.
And so that change gets made in the hospital, and if there's a continuity, that change will be maintained. But if that continuity is broken, there's a chance that you'll go back on the same regimen that you were on before, not incorporating the new important changes that were made.
Yes.
So that is a real important point about continuity.
Yes.
Okay, so people, I think, now understand how important blood pressure is. And seeing the doctor, that's how you get your blood pressure, and that's how you get it treated properly. And that's something that we call modifiable. You can get your blood pressure under control, then you're not at risk. That risk factor for a stroke is gone.
Yes.
Now, you said about high cholesterol.
Yeah. So when we have high cholesterol in our body, it can get deposited in the arteries which are going to the brain, and sometimes they rupture. They form the plaque, and that can go into the brain, and that's how the problem can start. So it's a modifiable risk factor, and there are number of medication to control your cholesterol, and that's why we give statin when the patient come to the hospital for the first time, and completely we can bring it under the control. There is no problem with the cholesterol. It's just you have to follow the advice of the doctor.
So you can get the cholesterol under control, and you know it's cholesterol, but the doctor knows there's a whole lot of things that go in there. Good cholesterol, bad cholesterol,
Yeah.
triglycerides, all that stuff.
Exactly.
And the doctor will manage that and get you on the regimen that you need. Maybe it's dietary modification, other things, but also medications to get your cholesterol down into the safe range.
Yes.
And so that can be taken out as a risk factor
Risk factor.
for strokes.
Yes.
Okay? And I think you also mentioned blood sugar?
Yeah, blood sugar. So I have seen here many patients with a high blood sugar. Some of the patients they have well controlled blood sugar, but I see all the time in the hospital they are coming with the blood sugar of 600, 700, 800. Yeah, they stay in the ICU for several days. You need to understand one thing. If you control the blood sugar, you will control many things. It's like you will decrease the risk of heart attack, you will decrease the risk of stroke, you will protect your kidney. It's one of the leading factor which can damage the kidney. And once you control the blood sugar, your blood pressure also improves faster when you control the blood sugar.
Oh,
Yeah.
okay.
And in order to control the blood sugar, you will decrease your blood pressure and the cholesterol simultaneously.
Wow.
Yes.
So that's an important one. And that's also one that the doctor obviously helps you with.
Yes.
And, you know, it's a big, complicated thing, and there's lots of different kinds of medicines, and there's insulin, and there's other kinds of there's lots of kinds of insulins, and what is exactly the right one for you, that's what your doctor figures
Doctor
out.
will figure out. Yes.
He'll figure that out for you. Okay, and then, of course, smoking, and boy, I'll tell you, I mean, there have been advances,
Yeah.
but it's still a very, very difficult problem. Just last night, you know, I had to go, I forgot, I had to go out and get some milk. So I went down to Rite Aid to get some, I can say that on the air, Rite Aid. Nice store, I like the people there. Anyway, I went down to Rite Aid to get some milk, and a lady was checking out in front of me, and she bought 2 packs of Marlboros, and that
Wow.
was like, I don't know, $15 or $20 for, holy smokes. Well, maybe that's the wrong term. But very, very expensive.
Yeah.
So it costs you a lot of money to kill yourself.
Exactly.
Exactly. And I remember when we were kids, they used to be 25 cents a pack. Now they're up to what, $7-8 or something?
Yeah.
It's amazing.
Holy smokes. From your perspective, my understanding is that primary care physicians really can help people quit smoking.
Yes. Yeah, so what I tell my patient, and actually I'm successful in this thing. What I tell my patient, don't stop smoking just today or after 1 week or 10 days or 1 month. So my first question, how much cigarette do you smoke? They say,
Patient smokes a pack a day,
yeah, let's say, so I don't know how many cigarettes in a pack.
20.
20. Okay, so I asked the number of cigarette, 20. Okay. Right from today, and you will come to me after 1 month. I want you to be smoking only 15 cigarettes. Write down every day how many cigarettes you're smoking, and I want you to be on 15. Don't stop, because you cannot stop. If you like something, you did your whole life, you cannot stop just in 1 day. So lots of time physicians just say stop the smoking and they go up. No, cut down the smoking, 20 to 15. Next month target is 10, then 5. Just cut down slowly. Even if some of the patients who come to me, I cannot keep like 15 cigarettes. But I'm smoking 18. Yeah, you did a great job. 18, fine. 20 or 18, that's fine. Let's go for 15 next month. That's how you cut down the smoking. But some of the patients I cannot do it. Then in this case we have some medication. We can give the medication. So smoking, there is a nicotine in the smoking. So what we do, we give the patch or the tablet of the artificial nicotine that can decrease the craving for the smoking. But we try for voluntary, if someone want to smoke, stop smoking, we try that first. Otherwise we have medication.
So you're not alone.
You are not alone, yeah.
See, I mean, if you're trying to smoke, it's daunting, because the physiologic strength of the smoke, of the hold that smoke has on you is very, very strong. Everybody who's tried to quit knows this. I quit smoking in 1975, all right? And it was very, very difficult. Not impossible, but it was very, very difficult. So believe me, I understand. And when you take something like that on, it can be very frustrating and very discouraging. But you're not alone, and there is effective help. And if you can really stop and understand the significance of the smoking to your life, to your health, to your ability to enjoy life, to your ability to look after people that you want to look after, I mean everything. Smoking is incredibly destructive. It's incredibly destructive. So it is definitely something that you want to get out of your life, and you're not alone, and your doctor can really help you with it.
Yes.
Can't emphasize that strongly enough. All right. Well, Pat, we've covered a lot of information here today, I think.
Very interesting information.
Do you think it was clear? Do you think?
Absolutely. And I learned a lot, again, as I always do with these interviews. I did have a question.
Please.
That was sent in to us the other day, and I said I would ask it. I almost forgot. They wanted to know what the normal oxygen level is supposed to be. I guess this person had a low oxygen level of 89. Is that low?
So oxygen level depends upon patient to patient.
Okay.
It just seems like for someone have blood pressure 110 over 70 is normal, or maybe 120 over 90 is normal. So oxygen level depends. But if you ask me how much should we like to keep it, it should be more than 90 or 92%.
Okay.
But if the patient have COPD or they have any lung problem, then we are okay even if the blood oxygen is more than 88.
88.
88.
Okay.
Okay. But if you don't have any symptoms, like you don't have palpitation, you don't feel dizzy, you don't feel lightheaded, you're working almost every day without being short of breath, and you are having 89%, it's okay.
Okay. All right. Fair enough. Appreciate it.
Well, again, we want to thank Dr. Kumar for taking the time to come over and talk with us today. Don't forget, April 13th at 6 o'clock here at 6 p.m. at UH Conneaut. Dr. Kumar will be here. Anyone can come in. Doesn't cost anything. He'll sit down at a nice table with you, and you'll be able to go over and ask very individualized things.
Yes.
And he will sit and talk with you and explain things with you. That's part of our Health Matters that UH is doing. Okay? All right, well, I guess that's going to be it, Pat.
Excellent show today, and we want to thank everybody for watching Your Health Matters with Dr. Benjamin Bryant and our special guest today, Dr. Kumar. We'll see you down the road.